So now there are some medicines also which will help, which definitely helps us in improving the quality of the eggs, and in turn it helps us in improving the success rate of the IVF cycle. These molecules are really very, they have been proven to be successful and beneficial in many studies. So we have many natural resources also of all these multivitamins. We also have their medicine in the medicine form also. So the if you look at the picture, these are eggs basically, and if you look at them, these are the quality of the eggs which are being shown. This first one, if you will see the which one is available, the eggs are usually very clear. They are actually completely round. So the first picture is of a very good quality egg. But if as we go move downwards and we see the further, these are bad quality eggs, and these are actually we get them. Patient doesn't understand what is the difference. Patient, they just undergo an IVF cycle, and then they say, okay, my friend's IVF is conceived in the first cycle, but I'm not able to conceive. So we try to provide them the pictures also. Whenever I'm doing an IVF cycle, we are providing them with the pictures of their gametes, the pictures of their embryos, so that at least they should know, they can compare what is the difference, why the embryos are not A grade or B grade or C grade. Some people, they are getting A grade embryos, and they definitely have a good success rate. I myself took out the success rate analysis of our cycles that we did, and I'll tell you, normally, as we say, on an average the success rate of an IVF cycle is 40%. Whole all over world it has been documented as 40%, maximum of 50%. But I'm telling you, when we took out the data, we saw if we are able to make a grade A embryo of day 5, that is called as blastocyst. So all the patients in which we could have a grade A day 5 blastocyst, the success rate of such cycles came out to be as almost 80 to 90%. So this is the importance of a grade A embryo. What is happening everywhere? Everybody is just taking out the IVF cycle success rate on the basis of, okay, this much, this number of cycles were done, and this many people they conceived, this many people they delivered a baby. But when we took out the data, okay, when we had a grade A embryo of blastocyst day 5, then the success rate was actually 80 to 90%. So this depends upon this quality of the eggs which are being shown here. We can say, from if we move from A till H, this is the deteriorating quality of the eggs. Some are differently shaped, some have different numbers of nuclei, some have different number of intra cytoplasmic the organelles that we see. So this is not good. This A grade, this egg which is shown in this A box labeled as A, this is the best egg that we have, and this can be achieved only if you follow all the dietary changes, lifestyle changes, and if you can add these multivitamins through your diet or through multivitamins, whatever. But these have been proven to improve the quality of the eggs. If we discuss them one by one, melatonin is one molecule which is really important. Vitamin D is also important for improving the quality of the egg. These are the, actual studies where they have found out that these molecules really improve the quality of the egg, and then they improve the quality of the embryo. This is a picture from our lab. This is we are doing ICSI. These are again the eggs which are visible, and we are just injecting sperms in these eggs. So obviously you get such a good smile when you get a good quality egg. And we
Yes.
become really sad when we get very bad quality eggs. So uh, similarly, when as we were talking about females, it is equally important for males. We need good quality sperms to make good quality eggs and embryos using those eggs and sperms.